I'd like to talk to you today about our ramp-up plans at McMaster Children's Hospital. The first phase of COVID required us to prepare for a potential surge. Now that our communities have done such a fantastic job helping us flatten the curve, we're able to look at starting to expand the services here at the hospital. There's a lot of things to consider, but there is room for more people to be coming to the hospital or for us to continue to care for patients and families virtually in some of the new things we've put in place and the new systems we've learned and established during COVID. We're going to have to prioritize the most urgent cases first, but in terms of understanding where things stand, the direct information will come from your individual physician. So it would be wise to contact their office and ask them to let you know on what scheduling might look like for your condition with your specialist. Unfortunately, we're not yet able to go back to 100% capacity the way things were before we had ever heard the word COVID. We still need to maintain capacity in the system for COVID patients, and we still need to prioritize safety, infectious risks, social distancing, PPE availability. Things have become more complicated for us to consider, and therefore we're going to be ramping back up one step at a time so that we can evaluate and learn while we continue to maintain safety and ensure that we're keeping our patients and our families as safe as possible as we care for them. We have learned a lot during COVID, and we've made adjustments and expansions into virtual visits with your physician or your healthcare team member. It's important that we stay in contact with our patients and families, and we've had to learn new ways to do that. So if you contact your healthcare providers, they can give you options and you can discuss what the best way and safest way it would be for you to continue to get the medical care that you need, but maybe not everyone will need to come into the hospital for an in-person visit. Maybe we can adjust with conversations on the telephone or appointments by Zoom or video technology. There are options, and it's important that you know your options and we pick the best and safest option for you and your family. We truly appreciate your patience as we work to reestablish and provide care for those with the most urgent needs. If you have any questions, I'd ask you to contact your clinic directly and sort through the options for how you can receive care.